Good evening. I'm Charlotte Jackson, president of the Camellia Rose chapter of the Links Incorporated, and we welcome you to our live stream event. How far yet to go now? The state of women in Georgia in 1970 and today. Our speakers, Andrea Young, the executive director of the ACLU Georgia, Dr. Deirdre Oakley, professor of sociology at the Georgia State University, will discuss the status of women going from 1970 until today and tell us what research says about the state of women and what concerns are available for us to start talking about when we're thinking about our advocacy initiatives. We are joined by Dr. Nsinga K. Burton from Emory University, who will serve as our moderator. Thank you for joining.
Thank you for having us.
Great to be here.
All right, we're going to jump right into this. Deidre and Andrea, let us know, what will we be seeing soon? Like, what are you all talking about? When we talk about the state of women between 1970 until now, what exactly, can you talk about the type of study that is, please?
Yes. So this project originated over a year ago when the Georgia legislature voted to take away women's rights to make very personal and private decisions about their reproductive health. And so I went to Deirdre to say, we were in litigation at that time. And I went to Deirdre, who's professor of sociology at Georgia State, to say, I'd like a study to show how much progress women in Georgia have made since 1970, since we had more autonomy over our reproductive health choices. And she and Ifani, her doctoral student, came back and they said, look, there have been some improvements in Georgia, but compared to our peers, women in Georgia are behind. And so the report, really changed to reflect the facts of what we see. So what we want to walk you through today is, some of the issues that we found that are really impactful in terms of women's abilities to, have the lives that we want to lead. But our government, our state government especially, is just not supporting those choices.
Okay. And Deidre, is there anything you'd like to add before we move forward?
No, it's been a pleasure working with Andrea and the ACLU of Georgia on this. And I believe Andrea said earlier that the full report is now up on the Georgia chapter of the ACLU's webpage.
Perfect.
Right. Great. So just looking at a lot of the really key issues that affect women and families, what we found is that by every measure, health, education, income disparities, our lawmakers are failing Georgians. We can go on to the next one. Deirdre, you want to talk about the research, why reproductive health policies matter?
Yeah, what we found, not only that Georgia was behind their peers, but what we also found that research has shown that states that have adequate reproductive health policies, which include a range of things: prenatal care, postnatal care, adequate child care, maternity leave, etc., work flexibility. Actually, women in those states were more upwardly mobile than states that didn't have adequate reproductive health policies.
So on the next slide, so when the ACLU went into court to challenge the Georgia legislature's 6-week ban on reproductive decisions, we brought in Sister Song as our lead plaintiff. And Sister Song is a reproductive justice collective that really talks about women's autonomy and women's rights to have children, not have children, and parent the children we have in safe and sustainable communities. And so for so many women of color, the challenge is also, can we parent our children in the way that we want? Do we have true freedom of choice to make these decisions. Do we have the child care we need? Do we have the health care? Do we have the education systems that allow our children to flourish? And so we wanted Sister Song to really make that point that this is about that this really is about women's autonomy and the families that we want to have, and our autonomy about when we make those decisions. And so we see that this is really a systemic, as we see even now with the COVID, that this is also part of the public health, the racist kind of public health crisis that Black women, in particular, Black and Brown women, are experiencing in our state.
Can you talk more about that, please? Like just how racism and social reproductive justice intersect?
Mm-hmm. You want to take that, Deirdre?
Yeah, I mean, there's a whole history of this, and we'll talk about it more going back to 1970. But basically, in any kind of institution in the United States that has been around, historically been around, racism, systemic racism is embedded within them. And if we take public health or healthcare, there are issues such as how Black women are treated by their doctors. And I think if you go to the next slide, we'll talk about, this is really important, we'll talk about maternal mortality. And that's just a really good example. Okay, so in 1970, Georgia had the highest US maternal mortality rate in the country. And today the state has one of the highest maternal mortality rates at 40% per 100,000, but it disproportionately affects Black women at 62.1% for Black women. I mean, this is a real crisis, and it points to the systemic racism that's within our institutions, in this case, within the healthcare institution. So you can say that racism is a public health crisis. So why would it be so much higher for Black mothers than white mothers? And there's a whole bunch of different reasons for it. And it really boils down to what kind of quality care you have, depending on your situation. But maybe even more importantly, how the doctors treat you. Do they listen to you? There's already studies out there that show that doctors don't really take pain that seriously among Black women. And so a lot of times these deaths happen after the child is born. And so the pregnancy, the delivery has gone fine, but then problems like hemorrhaging, embolisms, stroking out happens, and it could have been prevented if the doctors were really paying attention.
Yeah, there have been some high-profile cases of that happening. Serena Williams talked about her issues. Also, a young woman, Judge Hatchett's daughter-in-law, yes, had something happen. Unfortunately, lost her life due to this issue. So it's kind of on the radar. But is there anything in particular that can be done in Georgia? The numbers off the charts here.
Well, one of the things that we did advocate for, we really shamed the legislature in saying, about this issue. And so in the last session of the legislature, with almost unanimous support, they did extend the period of time for Medicaid deliveries for low-income women from only 2 months after delivery to 6 months. Because as Deirdre was saying, so many of but what we really need is, we did not get the Medicaid expansion in Georgia that Obamacare provided for. So you and I are paying taxes for people to have health care in New York, but our legislature won't pay the 10%, kind of copay for people who work at McDonald's, nurses, aides, all these people in the service industry who should be able to have health care. So a lot of our women just do not have access to the prenatal care, the postnatal care, so that they can have healthy outcomes with their deliveries.
Okay, thank you.
Mm-hmm.
If we look at just healthcare in general, reproductive well-being, Georgia continues to lag behind in women's health and reproductive well-being. If you look at healthcare insurance coverage, the state actually ranks 48 for women's healthcare in the nation. The state has no family leave program. And this is really important. Of the 159 counties in the state, 70 are now without OBGYN care. So if you've been following this, or if our viewers have been following this, there's been a lot of closing of rural hospitals around the state. And there's a lot of rural hospitals now that you can't get a baby delivered. So you've got to travel, long distances to actually even have just a delivery, let alone prenatal and postnatal care.
So that number that you said of the 169 counties in the state, 70 are now without OBGYN care. That's astonishing.
Yeah.
Yep.
How did that happen?
Because rural hospitals are closing. Grady is the only safety net hospital in the state of Georgia. Maybe if you're in Augusta, where the Medical College of Georgia was, but essentially people south of Macon have nowhere to go if they don't have health insurance. And the failure to, Obamacare would have provided a lifeline. I mean, even for Grady, would have provided a lifeline, and many of these hospitals could have stayed open if the Georgia legislature, they not only didn't vote to extend Medicaid under Obamacare, but they took the power away from the governor to be able to do it. So it can only be it can only work in Georgia right now if there's a vote of the legislature. That's why your state House member is so important, because they make these decisions.
Mm-hmm.
We can go on.
Next slide.
The next slide. Okay. And so, you would, a lot of times you think, well, it's about, we don't have the money, right? But Georgia is the 9th largest economy in the United States, right? We have the money. Our legislature chooses not to spend money on these things. And our GDP has steadily grown. But those of us who are in Atlanta, who grew up in Georgia, we know that the investments in our K-12 schools, for example, people pay fees today that I didn't pay growing up. I didn't pay fees to be a cheerleader, to be in the band. We sold a little candy and bought a new uniform. But the kind of checks that families are writing now just so their kids can be in basic activities are a reflection of how the state is not funding this. They're not funding the things that actually make for thriving families. And it's not because we don't have the money. We have the money, and we know Metro Atlanta generates more money, through the airport. All the Fortune 500 companies that are here. This is not a poor state, but our legislature behaves as if Georgia is Mississippi. And that's why we have the kind of outcomes that Mississippi and Alabama have.
Yep. And it's also important, and we'll get into more details with the next slide, that this growth in Georgia's GDP since 1970, women have played a vital role in this growth. And here we have some more women's progress in Georgia. This is actually really amazing. Today, 41% of the businesses in Georgia are owned by women, ranking Georgia second in the nation. More women than men in the state complete BAs or higher, and Black women have the highest labor force participation rate at 63.6%, and well over a third of Black women today own their own businesses. So it's not just women who are driving this, it's Black women as well.
Yeah, one of our viewers says that this is unbelievable, and I share. concern. One of the things, so it doesn't add up, right? So how are we so low in other places but so high in these places? Can you also explain like how these numbers kind of don't line up? Like what are the contributing factors? We know racism, we know sexism, obviously, but like what specifically is contributing to this disconnect between, what's spent on things that are important to families and women versus the money that women are driving and bringing into this economy?
So, John Wesley Dobbs and his grandson, Raynor Jackson, had a philosophy of the book, the ballot, and the buck.
Mm-hmm.
And so one of the things is that Black women we have not translated our economic power and our political power, in our educational power and our economic power into, really getting our fair share of the pie. I mean, we're always there, we're always there for somebody else.
Yeah.
So part of what, we're really trying to have this conversation for women to understand how much we are contributing, and we are not getting our fair share for the investments we are making, for the role that we are playing. Our priorities are not the priorities of the people who currently are in charge at the state capitol. Our priorities are not their priorities. And we have an opportunity to change that in November, which we'll, get around to. But, we had another example of, women's leadership in the state in the next slide, that right now, 3 of the nation's top medical associations are led by female physicians from Georgia, including Patrice Harris, president of the AMA. So women we are exercising leadership. We are taking responsibility. We are not getting the return on our investment.
Deidre, did you have something to add?
Yeah, I think Andrea is absolutely right. I mean, it's so impressive what women are accomplishing in Georgia, especially Black women. But I think we have a slide coming up that shows the pay gap, and this is really important. We have a tremendous pay gap between. Oh, we should talk about the legislature too. Well, so this is really important. In 1977, only 4.7% of our state legislature were women. By 2019, 30.5% were women. And that's more than any other state in the South. Mm-hmm. So,
and there are a lot of great women running for state house right now. I mean, women, scientists, lawyers, business owners, people with really superb credentials. And so there's an opportunity to have even more women in the legislature after November. A lot of them are running in the Atlanta suburbs, Gwinnett County, Cobb County, Athens, Clark, down in Southwest Georgia, if you've got family around Albany. There's some really amazing women who are running for office.
Fantastic. So it's not all bleak.
No, it's a lot. There's a great opportunity in November.
Okay, very good.
So we can move on to the next slide.
Yes.
Yeah.
There's a history to this. This didn't happen yesterday. If we go back to the 60s, Atlanta domestic worker Dorothy Bolden, who became very famous, co-founded the National Domestic Workers Union of America. I mean, she was a great activist. And basically, over time, what it led to was better pay across the nation for domestic workers, but also sort of a reevaluation of what we kind of call today, it's because of COVID, it's become more pronounced, of valuing essential work. Valuing being a cleaner at Georgia State University, valuing being working at a grocery store at the checkout. We wouldn't have been able to get through these past several months, or more than several at this point, without these essential workers that normally are just not really, they're just sort of taken for granted and not valued. And really, you can look at the work that Dorothy Bolden started back in the 60s as the precedent for that.
Yeah.
Yeah, that's interesting, because when we think about the role of frontline workers now, particularly in the COVID environment, the work that she did and that many are doing still, is very important. How so what's going on with the NDWA as it relates to frontline workers now in Georgia, in this COVID? Is there anything particular that they're doing in order to make sure that folks like Ms. Bolden was and people who work in those professions are protected?
Well, there's now care in action, and so some of the caregiver the attempts to continue to unionize caregivers advocate, for fair wages, for sick leave, which they still don't have in most instances, and so that work is going on, and they are also very politically engaged in this election cycle.
Okay.
Because I think a lot of us have had our awareness raised, of how important these workers are. But, and I think it's given a boost, to the like the $15, minimum wage kind of movement. Because here you are, you call them essential, but they don't make enough money to afford a 1-bedroom apartment, in Metro Atlanta. So, we've got to really put our money where really start respecting people, with better pay and working conditions.
Fantastic. Next slide, please. Thank you.
Yeah.
This is just another example of women leaders today. In 1975, Morehouse School of Medicine was founded. And today, more women are pursuing medical degrees than men. And you can look at that in the student enrollment in Morehouse Medical School. But we also have the first woman to become president of Morehouse School of Medicine. She's African American, Dr. Valerie Montgomery Rice. So just another example of just a very powerful, successful woman doing great things.
We have the pay gap one next.
Yeah, here it is.
So this is part of the answer to your question, and Singa, that
Okay.
is that we have a pay gap because you've got to have because this goes to the same narrative that women, especially women of color, are doing way more than their fair share. And we were always taught that you had to work twice as hard to get half as much.
Yes.
We didn't expect it to still be true in the 21st century, right? So, my grandmother certainly raised us that way, but here we are after, President Obama, after all this progress, but yet here we are, 63 cents on the dollar. And so we're putting in the effort, we're putting in the time, we have the credentials, and we're not getting the return on investment. And we've got to start, one, recognizing that, and and really start demanding better support and better better pay, and better attention to the priorities that we have for ourselves and our families.
So what's the barrier? Like, what's been the barrier to asking for more, or demanding rather, that, okay, we're investing this much into our state. We've been doing all these wonderful things, whether it's getting more educated, whether it's opening businesses, we're contributing to the economy based on just the number of Black women entrepreneurs in the state of Georgia alone. Right. So what has been the barrier to, getting more in terms from our government and legislature thus far?
Well, right now it's still controlled by a bunch of old white men. And they don't, I call it
Andrea, make it plain.
I mean, I call it a plantation patriarchy. They really, they believe this is the right thing. I mean, they don't, the sexism is just breathtaking. And we all know that if you scratch the surface, on most of the places that we work, there are these there are these patterns that women are not entitled to full value of what women are expected to serve. I can remember when I was chief of staff many years ago. I was chief of staff to Cynthia McKinney, and the Atlanta Journal and Constitution was going to publish the salaries of all the chief of staff for every member of Congress. And I was like so nervous. And then I found out I was making $20,000 less than the white men doing the same job. And I had I had a law degree. I had more experience than many of them, and so I think, we've also got to start asking these questions. We need to know what the white guy in the next cubicle is actually getting paid, because you would be shocked at what they get paid in many instances. And what we find is that the entry level, and also there's a lot of work about what it all comes down to, but but it's sexism.
Right.
And we don't have many mechanisms for holding people accountable for those differences. And I think right now there are a lot of folks doing a reckoning and really looking at their practices. But it's just beginning for people to really be honest. Deirdre knows it's true at Georgia State.
Oh yeah.
The faculty.
Yeah, it's actually outrageous. So you've got a lot of things going on there, but you can think about it the same thing as a law firm or whatever, or journalism. You have a PhD just like your male counterparts, but you're paid less.
Yeah.
And if you ask about it, nobody can really tell you. They can say things, well, so and so was an administrator. You haven't been an administrator. Yeah. It's just there's one excuse after another, and then you've got the double whammy going on if you're Black or Latina, in terms of being further marginalized, and it's just very hard to get a grasp on how if the university is basically run by a bunch of white men. How do you get them to listen to any of this?
Right. Yeah, it's a real. There's lots and lots of work and analysis. There are even studies that say even when women negotiate, they still don't get as much. But we certainly should be talking to our daughters about if you don't ever take the first salary they offer you.
Yeah, absolutely.
And do the research. Absolutely, you have to do the research. I ask. I actually ask people, like, what do you make? I know that's. I was raised in an era where it was tacky to ask somebody what they make.
That's right.
The only way that you can really legitimately get the compensation that you deserve, particularly as a woman, because I feel like they always lowball you.
Right.
Or want you less to do more. So, earlier we had Florida who said, this is unbelievable. But then we also have another person who is saying that Black women-owned businesses receive a paltry 0.6% of the funding that fuels all businesses. Says Black women are too busy hustling to keep their businesses afloat to harness that power. What are your thoughts on that?
Yeah. Well, I think we also saw this with the PPP program that women-owned businesses in Georgia, not just Black women, did not have the access. In fact, I know of some white women's businesses. If you weren't at Black women who were with Citizens Trust, maybe had a good shot at it. But the women-owned businesses at the big banks, got ignored. They had to go to small community banks and so forth and then a lot of times women-owned businesses are sole proprietors, so they don't have the extra time. But there was a group, Rita Samuels used to have an organization that really would fight for women to get their fair share of contracts. She would fight with the city. I know that before she died, she was fighting with the airport, to really up the percentage that women-owned businesses got from these government contracts, because most of the businesses, whether it's Russell or, Jack Mott, without that opportunity for those government contracts, they wouldn't have been able to grow in the way that we did. So this is one of the ways to directly leverage political power for economic power. And then we've got to ask those questions of, the mayor, all of the executives in all of our counties now. We need to be asking all of them, the school system, what's your purchasing? Coca-Cola, all these corporate, the Chick-fil-A, what's your purchasing what's your purchasing, what's your contracting, and what are you doing really, for Black women, not just even women in general, but what are you doing to make sure Black women have a piece of the pie?
Yeah, I mean, economic justice and this type of justice that you're talking about, reproductive justice, what I would call gender justice, those things of that nature are all inextricably linked. Racial justice, obviously, social justice. And so, yeah, I mean, you can't assume that just because it says Black that they're talking about women, or just because it says white that they're talking about white women. You have to definitely be clear and hold people accountable, particularly those who are in a position to do something to change it. Definitely. Next slide. Okay.
So, education is like another huge thing. I mean, I know that, like many of you, my grandparents believed that Moses gave down 12 commandments, and that 11 was thou shalt own thy own home, and 12 was thou shalt send your children to college. And so, we have really invested in education, and often Black women were, really a lot, took a lot of leadership roles in integration. We have, we do still have a divide between Black and Latin women in terms of being less likely to be, have associate degrees or bachelor's degrees. But since the downturn, the economic downturn, the Georgia legislature has cut $9 billion from the budget for public education. So I would say if there is one thing that, along with the Medicaid, along with full adoption of the Affordable Care Act, that Link should really, and all Black women sororities and everything should be advocating for, is that we fully fund K-12 education in the state of Georgia. And we had been climbing up in the ranks under Roy Barnes in terms of public education, and so we see the decline in the services and the quality, and Atlanta has obscured some of that because we took a bond issue, and Atlanta taxpayers had took a big load to improve our school facilities, but the state by its own measure is underfunding public education by their own. I mean, if we did assessment, we would probably say they're underfunding it by 20 billion, but by their own assessment, they're underfunding it by $1 billion every year. And so just to get that kind of, to sort of restore that level of funding that their own analysis says we should be getting could make a tremendous difference, for our families. And so our younger families are paying school fees. They're not getting the services that I know I got as a public school student in Southwest Atlanta. It's a very different burden on young families today, because there's this kind of user fee attitude, and you see it at the universities. I mean, that the fees that kids pay keep going up and up and up. I know when my daughter was at University of Georgia, she said, I'd rather they raise the tuition because it's easier to get a scholarship for tuition, but nobody wants to give you a scholarship for your school fees. And so we really have, we really have underfunded education, and it makes it, harder for, lower income Black women and women of color to sort of make their way up the economic ladder.
Yeah, one of our readers wrote, Trojanelle wrote, Black women incur more debt in establishing businesses and in pursuing advanced and or professional degrees, and we don't get a return on our investment. This is discouraging. Yeah. So then when you add on to that, all the other ways in which we are taxed, or, we call it the Black tax, in terms of fees and things of that nature. It's definitely disconcerting. And the fact that Georgia would be on the record with underfunding education and proudly state that,
Yeah.
And, as if $9 billion since 2011 is not a major deal, is really quite shocking. Deidre, did you have something you wanted to add?
Yeah, I mean, there's a couple of other things here. First of all, the fee thing in public education and college universities is outrageous. I see it with Georgia State students all the time. But the other thing, the student debt. So
Yeah.
you talked about debt in business and education. Um, I don't have the numbers on it, but if you look at a place like Georgia State, where over 40% of the students are African American, probably about 65% are of color. You're talking about young people getting out of college with staggering amounts of student loans, which basically then can paralyze them in terms of success, of being, all that money that they have to pay back, and they don't have very much time before they have to start paying it. The other two things are that there's also a rural urban divide, just like there is with reproductive care. So the college students in Georgia typically come from the greater metro Atlanta area. So that's number one. But the next one is historical, and it's kind of ironic, and it gets back to one of the major themes here about Black women, in particular, being trailblazers in Georgia. It was Black women and girls back during the 1950s and 60s who really drove the whole desegregation of public education. The girls would be sent into the Black elementary and high schools before boys were. And then you had the three women who won the NAACP case for Georgia State to desegregate Georgia State. Of course, they were denied entry for a bunch of different reasons. One of the ladies was married. No, she wasn't married, but she had children, so she was denied on moral bases. One was a returning student, meaning an older student, which Georgia has a reputation today of having a lot of non-traditional students. And so she was turned away because she was too old. These women were recently celebrated. There was a professor at UGA who wrote a book about them. But so again, you've got this theme of these women just being behind a lot of this stuff and then just coming up against a wall when it comes to the Georgia legislature.
Yeah. And we have I mean, it's it doesn't line up. So all the great things that you all are talking about, it's hard to focus on those when it's so many other shocking and I would say really discouraging, as Janelle said, information about Black women in general, Black women particularly in Georgia, and how do you reconcile that? One of our viewers, Sandra was asking, with cuts since 2011 in K through 12, where does Georgia rank currently among other states? Do you all know that information?
Good question. I don't know if I don't think we ranked very high. But I don't have the ranking on top of my head, but definitely ranking below like Massachusetts and New York and some of the East Coast states. But the South in general lags behind other regions of the country along all of these dimensions.
Yeah. And one of the challenges that Georgia should not be comparing itself to other southern states.
Yeah.
It should be comparing itself to, Colorado, Connecticut, Oregon, and those kinds of investments, and Washington State, based on the kind of industry that we have. I mean, we have first in class higher education institutions. I mean, Georgia Tech, Emory, UGA, Atlanta University. We have first in class, the best, some of the best institutions in the nation, and yet we're not, and yet we're, the big misgiving is, we're not putting the investment in K-12, and even with Georgia pre-K, we still don't provide enough early childhood programs for children.
All right. I'm reading an article here from the AJC that says Georgia's number 31.
Yeah, that's right. Yeah.
Which actually was an improvement.
Yeah, I would have thought it was lower, but
yeah, that was an improvement. This came out in 2019.
Yeah.
So that's not good.
But remember, our economy is 9. So we have the ninth largest economy, and that should be our benchmark.
Yes.
The resources that we have to put towards, towards health and education outcomes. And when you poll Georgia voters, Democrat and Republican, Black and white, education and healthcare are their 2 main priorities. Over 70% of Georgia voters count those 2 as their most important concerns. And yet we are not putting the resources in the state into the education and health, which is a priority of voters.
Yeah, and that's what this study says that I'm reading. I'm just reading a little bit, and it says education and healthcare are the lowest for Georgia in this particular study. Wow, this is so interesting. We have this information. Can we go to the next slide, please? Thank you.
I think, kind of going along with a lot of these is is that the state sort of still acts as if, families are, husband who works, wife at home kind of model. And that's not the reality, hasn't been, for decades. And there's kind of another layer of that in terms of federal policy that for Black middle class households, there is a lot more parity between the income, of the husband and wife. And so often, federal policy makes it even more difficult. If you notice when you pay your taxes, there's kind of a penalty for having a more egalitarian income in your household. Then the tax system tends to say, well, there's going to be one primary breadwinner, and then the secondary breadwinner is going to be at a much lower level. And Black middle class households tend to have much more parity, and policy doesn't reflect that. So, why is after school care so expensive? Why are because it's not, and where everybody is now kind of paying attention, with COVID, that people you can say that schools aren't daycare, but people use schools so that their kids go to school and you go to work. So they do serve that function, and but yet they want to live in this mythology that there's someone else there who has nothing, that so you don't have after school programs that are affordable for families. You don't have, the hours don't bear any resemblance to people's work schedule. So there's just a lot of these things that exacerbate the inequalities, because what happens when people's childcare comes through, even if you're the higher earner in the household, it tends to be the mom that goes and picks up the slack, right? So, these things also fall when the social safety net isn't there. It falls disproportionately on women.
Yeah.
Deidre, anything you'd like to add?
Well, just that, we're in the middle of this pandemic, and if you look at families, low-income families in the state, particularly African American and families of color, you're going to see a disproportionate effect of evictions going on in terms of lost jobs or lost hours, or not being able to get your kids to some kind of child care, so you can't get to work, and then you can't pay your rent. And we don't have any statewide moratorium on rent or evictions right now. There's more protections within the city of Atlanta, but across the state, it's something that's going to affect particularly single female-headed households more than others if something is not done rather quickly.
Yeah, absolutely. And we have one of our viewers, Glenda, says that if you have a child in private school from 4K to 12, from 4K to 12, you'll spend a quarter to $500,000. And so you have that factor too, right? So, schools aren't doing what they're supposed to do. The public schools aren't doing what they're supposed to do. So I'm going to send them to private school. But then what do people who have to send their kids to private public school do if they don't have a support system in place? And if they can't, as you said, Deidre, work in COVID, if they can't make it to work during, a pandemic like COVID, where it's like, who's going to take care of my kid if I'm at work all day? They can't watch themselves. You'll go to jail, right? Especially if you're a woman of color, you'll go to jail. So, what is the solution? And then Trojanelle wants to know also, if we're not putting money in healthcare, if we're not putting money in education, where is the bulk of the money going that is being spent in the state? And I would also argue or ask that Black women and in general, women in general, Black women in particular, are investing in the state. Where is our money going?
Mm-hmm. So one of the things that happens is that Georgia's taxes are very regressive. So your state taxes in Georgia are like a flat 6. Actually, I think they cut it. Last year they actually cut taxes, I think, to 5.75%, and it's a flat tax. So if you make 20,000, you pay that tax, and if you make 400,000, and Georgia State, you only pay that. It's not graduated like your federal income taxes, and so wealthy Georgians are not paying their fair share, and lower income Georgians are paying more than their fair share. Then you've got a situation where, with this whole education budget, if they were to tax people who made over $400,000 a year 7% instead of 6, they could raise that $1 billion.
Yep.
And they will not even allow it to be discussed. In fact, they got rid of somebody at the Georgia State Fiscal Policy Center who was like trying to raise the issue, and the legislature said, don't let her come back, don't send her back over here. They would not even discuss it they would not even publicly discuss the option. And so Georgia's state tax system needs to be reconstructed. The other thing that they do is that they give tax breaks and tax incentives to companies. So rather than say, let's take that money, and some of that incentive goes to the film industry, but like it's a total, there is no ceiling, there's no cap on the tax credits that go. There's recently been an audit because some of these programs are not properly audited. They're going out in a way that doesn't necessarily create jobs for Georgians, which is what they're supposed to do.
Yes.
And then they don't create pools of money so that you can say, let's have more businesses, so that Georgia-based businesses could be more competitive, in the film industry or these. But Georgia, Atlanta, and all these areas, Gwinnett, Cobb, they do all of this. They give all these tax incentives to companies, and Georgia State has done a lot of analysis that it does not matter. And that states really need to get out of the business of offering incentives to get these businesses located here. If Amazon wants to come build a warehouse, they're going to build a warehouse. And the fact that you gave them, you gave them all these tax incentives. So Georgia's way of giving tax incentive to big companies is another thing that undermines the revenue that we have to put into health and education programs.
All right. And one of our viewers wants to know what happened to the lottery money going to the schools.
The lottery money goes to two things. No, lottery goes to Hope Scholarship, and it goes to Georgia Pre-K.
And Georgia Pre-K.
And it goes to the Hope Scholarship first. So one change would be if Georgia Pre-K got the first dollar of the lottery money, then you could have universal pre-K. Right now, we really don't have universal pre-K.
No, we don't. I have a 4-year-old.
Kids can show up, right? Kids can show up and they don't get a slot. So we really don't have universal pre-K. And there's no income cap on getting the Hope Scholarship. So literally, people are flying planes to UGA, and their kids are on a Hope Scholarship. They're, they used to say the Hope Scholarship at UGA, the kids would say, okay, the parents would say, okay, if you go to UGA instead of Chapel Hill, I'll buy you a car. So they get a $30,000 car because their kid is on the Hope Scholarship. And if they went out of state tuition, to Chapel Hill, or they went to Vanderbilt, it would cost them $40,000 a year. So the parents figure they've come out ahead. Plus, it's good bragging rights at the country club. So, originally Hope Scholarship was capped at, there was a family income cap on it, but now there is no cap. And so kids at Westminster are going to UGA and Georgia Tech on a Hope Scholarship. With paid for with lottery money.
Yeah, and there's a disparity based on your race. More white kids get the Hope Scholarship than black kids, and it's not necessarily because the black kids are performing more poorly. It has to do with where the schools are and a whole bunch of other different types of reasons, but it's inequitably distributed.
Yeah.
So there's that to consider too.
Okay. Well, I'm learning so much tonight from you ladies. Oh my goodness. Can we go to the next slide? So if you have questions, we're going to be winding down soon. So get them in because we have to make use of this brilliant display today on this live stream. So send in your questions, please. Next slide. Okay.
Yeah. So some of our policy recommendations were, I think, mandating paid family medical leave. So right now, if families need medical leave, like right now, how many people need it? They're taking care of families who have COVID, but they can't get paid. There's no requirement in Georgia that your employer pay you when you're out on leave, taking care of your family members. Ratify the ERA. There's a big discussion that the Equal Rights Amendment could be ratified. Virginia recently did, and it could become law, which would make discrimination against women illegal. Georgia's state laws on civil rights laws are very uneven. We don't have a comprehensive civil rights law in Georgia that protects women in all the domains of that it should. Repeal the abortion law. I mean, that was just passed. Fund the Medicaid expansion, which would basically mean take the Affordable Care Act and fully implement it with all of the resources that would bring to the state, and then produce an annual report on the state of women in Georgia, because as you all are learning, and as Deirdre and I learned, even asking these questions and putting all this information together, we listen. If you live in Atlanta, and you have a college degree, I mean, you're living a good life, right? I mean, we don't, but systemically, we're not getting what we're entitled to. And so, and more, maybe even more importantly, our daughters right now are not on track to get what they are entitled to. And so we really want to make sure that we are doing putting in place the things for them, and for our I have a granddaughter now, so I'm not trying to have her go through this again. So fortunately for us, we got an election in November, and we can show. Does anybody want to ask questions about those policy issues?
Any more questions? Okay. Deidre, did you have anything to add before we get to this election slide?
No, I think we should go straight to the election slide.
All right, let's do it.
So we've got an election coming up in November in the state of Georgia. Oh, Charlotte, you want to talk to that? I will say before that, let me just say, when we put in a plug for acluga.org, because on our website and following us on Twitter, ACLU of GA on Twitter, we are posting daily what's going on with the election. We have a lot of resources, even videos about how to vote, how to fill out your absentee ballot, where are drop boxes in your community. Two of the things we've been fighting for is that there be drop boxes, because we know we're going to have trouble with the sending back mail-in ballots. You can take them to a drop box in Metro Atlanta and hand deliver them right up until 7 o'clock on election day. And we've got the locations of where those are in Metro Atlanta. And as I said, on our Twitter feed, we will be daily posting the deadlines, posting how many days left, posting any changes and updates in what's going on. So,
Fantastic. Thank you.
Madam
And
President.
so this is our opportunity to make our voices heard. We've heard all these policy issues. We want to have our voices heard in decisions that are made that affect our lives. And one of the best ways that we can do that is by voting. And so here is a slide containing all of the important voting deadlines. And so what I would do right now is take out your phone and take a picture of this slide, and then you'll have all of the important dates. Remember, the voter registration deadline for the November 3rd general election is October 5th, 2020. Absentee voting, if you're going to absentee vote, you have to request your paper ballot or absentee ballot by October 15th of 2020, and make sure you get it returned by October 30th so that there's sufficient time for it to arrive and to be counted. And then also remember, you can also take advantage of early voting. It's one of the benefits that we do have in Georgia is pretty liberal early voting. That's from October 12th until October 30th. And remember, we're talking a lot about these presidential ballots, but vote all the way down the ballot because those local elections are the ones that really affect how you live day to day. And so if you're going to exercise your vote, exercise it fully. I want to take the time to thank our speakers, Andrea, Dr. Oakley, and our wonderful moderator, Nzinga K. Burton, or Dr. Nzinga, for doing this great presentation and providing us with so much information. There's so many opportunities for us as links or as other community members to identify what the policy matters are that affect us. And this will give us a great opportunity to look at future points for advocacy. And so we're going to be having other live streams coming up. So stay tuned to the Camellia Rose Facebook page and we'll let you know when our next live stream is coming. Thank you to our viewers and stay safe and healthy. And thank you to our speakers and have a great night.
Thank you.
Thank you very much.
Thank you.